Today, let us discuss about H2 receptor antagonist. H2 blockers. These are the because of structural similarity to the histamines, these drugs act selectively by competitive blockade of parietal cell H2 receptors. These H2 blockers are highly effective. They can cause tolerance probably due to downregulation of receptors. A rebound increase in acid secretion may occur after their withdrawal. Histamine receptors are the G protein coupled receptors in which histamines are the primary endogenous ligands. These drugs block the H2 receptors in the gastric parietal cells, thereby they decrease the gastric secretions. H2 blockers clinical use. These are used in gastric esophageal reflux disease, duodenal and gastric ulcer disease, NSAID-induced ulcers, prevention of stress-related gastric bleeding, prevention of ulcer recurrence, Zollinger-Ellison syndrome. Though proton pump inhibitors are more preferred, it is preferred in treatment of surgical conditions. H2 blockers are used to treat chronic urticaria as they increase the efficacy of H1 antagonist. Types of H2 blockers: famotidine, cimetidine, nijatidine capsules. Mechanism of action: these H2 blockers decrease gastric acid secretion by reversibly binding to histamine receptors located on gastric parietal cell, thereby inhibiting the binding and activity of endogenous ligand histamine. H2 blockers thus function as a competitive antagonist. These H2 blockers decrease the acid secretion, thereby decrease the decreases the symptoms of ulcers and gives symptomatic relief in case of ulcer conditions. Doses. According to the diseased condition, doses are adjusted. In case of 50% acid inhibition, cimetidine dose initial dose is 400 mg, maximum dose is 800 mg. Famotidine dose is 20 mg. Nijatidine dose is 150 mg. In case of duodenal ulcer, dose is 800 mg. In famotidine 40 mg, nijatidine 300 mg. In case of gastric ulcers, dose is 400 mg for cimetidine, 20 mg for famotidine, 150 mg for nijatidine. In gastroesophageal reflux disease, cimetidine dose is 800 mg, famotidine dose is 20 mg, nijatidine dose is 150 mg. NSAID ulcers 400 mg, cimetidine dose, 20 mg famotidine dose, nijatidine 150 mg. Based upon the disease condition, drug and dose are selected. In some cases, cimetidine is used. In some cases, famotidine is used. In some cases, nijatidine is used. Based upon the drug, dose is preferred. Adverse effects: headache, myalgia, constipation, mental status changes occurs with IV cimetidine. Endocrinal effects are seen with cimetidine as it inhibits the binding of dihydrotestosterone to androgen receptors. It causes impotence in males. It inhibits the metabolism of estradiol and increases the serum prolactin levels. Gynecomastia in males, galactorrhea in females. H2 blockers reduce the secretion of intrinsic factor, but not vitamin B12 deficiency. Drug interactions. Antacids reduce the absorption of H2 blockers, hence a gap of at least 2 hours should be kept in between the administration of these two drugs. Cimetidine is a potent inhibitor of CYP1A2, CYP2C9, CYP2D6, CYP3A4. Plasma half-lives of warfarin, theophylline, phenytoin, quinidine, beta blocker, tricyclic antidepressant, benzodiazepine, calcium channel blocker, oral hypoglycemic agents, metronidazole, and alcohol may be prolonged. Contraindicated. These drugs are contraindicated in the over the age of 50 with kidney problems, with hepatic impairment, allergy. The H2 antagonist should not be used with known allergy to any drugs of this class to prevent hypersensitivity reaction in case of pregnancy and in case of lactation.